So welcome back, or welcome for the first time, to Paramedic Zach, where we're going to run through 10 flashcards, giving you 5 seconds to answer each question. So stay tuned for flashcards 31 through 40. My name is Zach, and this is Paramedic Zach. Alright guys, so we left off with question 30, so let's go on with question 31. Treat pain secondary to trauma with ketamine IV IO at a dose of blank. So the answer to this question is probably going to vary based on where you work, but when you're treating pain secondary to trauma with ketamine, a typical dose is going to be 0.2 milligrams per kilogram. Moving on to question 32. What are the 5 H's in the reversible causes of cardiac arrest? So your first H when determining a possible cause of cardiac arrest is going to be hypovolemia. Your second H is hypoxia. Third is hydrogen ions, i.e. acidosis. Fourth is hypo/hyperkalemia. And fifth, you have hypothermia. Alright, question 33. Name the condition. You have shortness of breath, decreased lung sounds over one side, a mediastinum shift, JVD, and tracheal deviation. So this card is trying to get you thinking in the direction of a pneumothorax. Question 34. A child's minimum systolic blood pressure can be calculated using the equation blank. So when trying to calculate what a child's minimum systolic blood pressure should be, you can use the equation systolic blood pressure equals 70 plus 2 times the age. So if the patient is, let's say, 4, you would do 2 times 4, which equals 8, and you do 70 plus 8. So that minimum systolic blood pressure would be 78. Question 35. If atropine is ineffective at treating symptomatic bradycardia, try blank. So like it or not, if your atropine is ineffective at treating a bradycardic patient who is symptomatic, you're going to move on to transcutaneous pacing, or TCP. Alright, question 26, or 36. Becks Triad is a diagnostic trilogy for the condition of blank and consists of blank, blank, and blank. So Becks Triad is 3 signs indicating cardiac tamponade. And those 3 signs are JVD, which is jugular vein distension. 2 is muffled heart sounds, and 3 is a low/narrowing pulse pressure. That is, your systolic and your diastolic blood pressure numbers or values are getting closer together. So like a pressure of 100 over 80. Those are very close. That's a narrow pressure. Question 37. If an intubated patient presents with decreased SpO2 and/or end-tidal CO2, use the mnemonic DOPE, which stands for blank. DOPE stands for displacement, such as the endotracheal tube, obstruction, such as a foreign body, a pneumothorax, and equipment failure. So make sure you're checking your intubated patient's DOPE whenever you see a decreased SpO2 or end-tidal CO2. Question 38. Inverted T waves indicate blank. So if you see inverted T waves on an ECG, it's most likely indicative of cardiac ischemia. Question 39. What are your 2 locations for IO insertion? So the 2 locations you can insert an intraosseous catheter is going to be the anterior humeral head and 2, the anterior medial tibia. Alright, and lastly we got question 40. What are the steps in order to treat a crush syndrome patient? So a crush syndrome patient needs to be handled very delicately due to a condition known as rhabdomyolysis. We'll get into the details in part 2, but essentially what happens is there is an excess of released potassium into the bloodstream. This, as you may already know, can cause a host of cardiac dysrhythmias. So the first thing you're going to do is get this patient on a cardiac monitor. Secondly, you're going to want to start an IV with normal saline, not lactated ringers, due to the potassium in the lactated ringers causing additional injury. The third thing that you're going to want to do is administer sodium bicarb at a dose of 1 milliequivalent per kilogram once you're ready to free the patient. Once you're ready to free the patient from whatever is crushing him, you're going to deliver 1 liter of normal saline. This is kind of in order to dilute some of the potassium that's in the bloodstream and hopefully minimize the injury to the kidneys and minimize cardiac dysrhythmias. Lastly, you're going to monitor for hyperkalemia or high potassium on your ECG. That would be peak T waves is your biggest indicator. So it's a lot to remember, but it's important to remember all of these steps when treating your crush syndrome patients. Alright, so that wraps up question 40. So what I'm going to do is change up the format of this channel a bit by introducing 5 episodes that are all rapid fire review. Then I'll circle back and do all of the part 2 in-depth review for each of those episodes. If you like this video, if it helped you in any way, please do me a favor and give me a thumbs up. It helps me more than you know. And if you'd like to get these videos regularly to help you pass your exam, make sure you hit the subscribe button. Thank you guys for joining, and I'll see you next time.